update. Our topic today is going to be on Nasia gonorrhea. My name is Carlene.
I'm Desiree.
And Rosalie.
Cheryl.
So Cheryl, exactly what is gonorrhea?
Gonorrhea genesis is ancestral and the gram-negative caucuses is aerobic and grows in mesophile temperature class. Hey Rosalie, do you know how it can be transferred?
Yeah, it can be transferred through sexual intercourse, vaginal, anal, and oral. And the mother can also transfer this gonorrhea during delivery and may cause eye infection and blindness to the child.
Oh, that's it.
Oh my goodness. So exactly once you have this bacteria in the body, it basically attaches to the non-ciliated epithelium cells via the villi of the membrane. And once it's there, it takes place through a process called parasite-directed endocytosis. And the lipopolysaccharide is the LOS, which is the outer membrane of this bacteria, is thought to be responsible for most of the symptoms of gonorrhea and triggers the intense inflammation process. And because of this infection and inflammation, a local immune response, the local IgA takes place. And this inflammation focuses on the host defense and becomes the pathology of the disease. And the immunity is, of course, strand resistant, and reinfection can occur. Instead of strand resistant, basically is strand specific. Some of the signs and symptoms of gonorrhea, of course, is the male can have a thick yellowish purulent drainage that is coming from his penis. He can have also redness and swelling of the penis. The female, however, can be asymptomatic, and she can have vaginal drainage, which can be yellow in coloration. She also can have burning of the urination and also frequency of the urination. In addition to the baby, when it has some of the symptoms they have from the eye is a yellow drainage that comes. Once you find out you have gonorrhea, of course you want to be treated. And the treatment of choice is Rocephin that is given intramuscular. And gonorrhea sometimes has a little co-buddy that travels along with it, which is chlamydia. And chlamydia, of course, you would need to treat that. And Rocephin, you'll need something else to go along with the Rocephin. So they can give you antibiotics that you'll need to take for the next 7 to 10 days. And the antibiotics of choice can be erythromycin, Suprex, or either azithromycin that can be given by mouth. It is very important that you complete this antibiotics. However, if you don't complete it, some of the complications that can follow is infertility, where of course you have problems having a kid, endocarditis, which can affect your heart, and dermatitis arthritis. So of course you don't want any of these things, so you need to make sure you take them. However, there is no vaccine for prevention of this medication. So exactly, Desiree, what is some of the preventions and stuff that can take place?
Well, you can prevent it by using condoms, practicing abstinence, and a monogamous relationship with your partner can also prevent that. And gonorrhea is diagnosed by clinical inspection by taking a sample of the infected area, like the rectum, the throat, the eyes, and you can culture it on a modified Thayer Martin plate, which has antibiotics and penicillins. And you'd have to use a reagent, the oxidase reagent, to see that the bacteria is positive. The one good thing about this thing is that you can't get gonorrhea from touching toilet seats. So it's okay. I mean, it's not okay, but it would be okay to touch a toilet seat. You wouldn't get that contaminated.
Oh, okay. So you won't contact this bacteria, this disease, gonorrhea, by the toilet seat. So I guess with it all four more said, if the faucet is leaking, call the plumber, because this toxic liquid can infect the cherry blossom. Thank you for joining us.
Thank
Have a nice
you.
day.